Hello and welcome. Today we'll be discussing carotid artery stenosis, a serious condition that can significantly impact your brain health. We'll explore what it is, what causes it, how it's diagnosed and treated, and most importantly, what you can do to prevent it. Carotid artery stenosis is primarily caused by atherosclerosis, a process where plaque, made up of cholesterol, fat, and other substances, builds up inside the carotid arteries. Over time, this plaque hardens and narrows the arteries. Factors that increase your risk of atherosclerosis include high blood pressure, high cholesterol, smoking, diabetes, obesity, a family history of atherosclerosis or heart disease, and a lack of physical activity. Essentially, anything that damages the inner lining of your arteries can contribute to plaque formation. Let's delve into the pathophysiology. As plaque accumulates, it restricts blood flow to the brain. This reduced blood flow can lead to transient ischemic attacks, often called TIAs or mini-strokes, or, more seriously, a full-blown stroke. The brain relies on a constant supply of oxygen and nutrients from the blood, and when that supply is interrupted, brain cells can become damaged or die. The severity of the consequences depends on the extent of the blockage and which areas of the brain are affected. Carotid artery stenosis is a fairly common condition, especially among older adults. Its prevalence increases with age. While exact numbers vary, studies suggest that a significant percentage of people over the age of 65 have some degree of carotid artery stenosis. Men are slightly more likely to develop it than women, and certain racial and ethnic groups may also have a higher risk. The signs and symptoms of carotid artery stenosis can be subtle, or they can be dramatic, particularly if a stroke occurs. Many people have no symptoms until a TIA or stroke happens. Warning signs include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, difficulty speaking or understanding speech, sudden vision problems in one or both eyes, dizziness or loss of balance, and a sudden severe headache with no known cause. Remember, these symptoms can be temporary, as in a TIA, but should never be ignored. Seek immediate medical attention if you experience any of these. Diagnosing carotid artery stenosis typically involves a physical exam followed by various imaging tests. A doctor may listen to the carotid arteries with a stethoscope to detect an abnormal sound called a bruit, which can indicate turbulent blood flow. Common imaging tests include carotid ultrasound, which uses sound waves to visualize the arteries, CT angiography, which uses X-rays and a contrast dye, MRI angiography, which uses magnetic fields and radio waves. Angiography can provide detailed images of the carotid arteries and show the degree of narrowing. While not strictly classified into types, carotid artery stenosis is often categorized by the degree of narrowing. Mild stenosis may not require immediate intervention, while severe stenosis, typically defined as a blockage of 70% or more, carries a higher risk of stroke and often requires treatment. Treatment and management options depend on the severity of the stenosis and the patient's overall health. For mild to moderate stenosis, lifestyle changes and medications are often the first line of defense. These include quitting smoking, controlling blood pressure and cholesterol levels, managing diabetes, and maintaining a healthy weight. Medications may include antiplatelet drugs like aspirin or clopidogrel to prevent blood clots and statins to lower cholesterol. For severe stenosis, surgical interventions like carotid endarterectomy, which involves surgically removing the plaque, or carotid angioplasty and stenting, which involves inserting a balloon and a mesh tube to open the artery, may be necessary. Preventing carotid artery stenosis primarily involves adopting a healthy lifestyle. This includes eating a balanced diet low in saturated and trans fats, cholesterol, and sodium, engaging in regular physical activity, maintaining a healthy weight, quitting smoking, and managing existing conditions like high blood pressure, high cholesterol, and diabetes. Regular check-ups with your doctor are also essential to monitor your risk factors and detect any potential problems early. The prognosis for carotid artery stenosis varies depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and treatment can significantly reduce the risk of stroke. Recent research focuses on improving imaging techniques for earlier detection, developing more effective medications, and refining surgical procedures to minimize complications. Studies are also exploring the role of inflammation in the development of atherosclerosis and potential therapies to target inflammatory pathways. Researchers are actively working to improve outcomes for individuals affected by this condition.